G'day everyone, Dr. Hannah Collins here. Now I know this might be a bit of an awkward topic, but stick with me because what I'm about to share with you today has helped thousands of my patients over my 20 plus years in practice. And honestly, it's something fewer than 2% of blokes actually know about. Look, if you've ever been in that situation where your body just wasn't cooperating when you wanted it to, you're not alone. It happens far more often than you'd think, and it can feel pretty rough, eh? But here's the thing. In this video, I'm going to show you exactly how to handle it, how to maintain your confidence, and most importantly, what you can actually do about it from a medical standpoint. Not just the usual, she'll be right approach. Before we dive in, do me a favour and hit that subscribe button and give this video a like. I make heaps of content specifically for you guys, especially those of us over 50, because you know what? You deserve a fulfilling life, full of love, connection, and yeah, good intimacy too. Right, so let's get stuck into it. First things first, and I reckon this is the most important thing I'm going to tell you today. Your masculinity is not defined by whether you can get or maintain an erection. I know that might sound like something a doctor's supposed to say, but after 20 years of sitting across from blokes in my clinic in Auckland, Wellington, Christchurch, all over New Zealand really, I can tell you this with absolute certainty. Think about it like this. Your intimate life is like a good old Kiwi car, right? You got the engine, the tyres, the steering wheel, the seats, the radio, all these different parts working together. Now, if one tyre goes flat, does that mean the whole car's useless? Course not, mate. You change the tyre and keep going. Same principle applies here. Your intimate life has many components, and one temporary hiccup doesn't define the whole experience. Now, there are heaps of reasons why this might happen to you. Could be you're knackered from a long day at work, could be stress about the bills, or maybe you had too much pavlova at tea time. These factors can absolutely affect your performance. But here's what I want you to understand. None of these factors have anything to do with your worth as a man or as a partner. They're just physical responses to physical circumstances. And here's a little secret I've learned from talking to thousands of women over the years. Most of them don't actually see this as the huge problem that us blokes think it is. As long as you're present, as long as you're connected with them emotionally, as long as they feel wanted and desired, that's what matters most. Often it's our own insecurities that make this seem like a bigger deal than it actually is. Women value emotional intimacy, connection, and feeling desired in other ways, just as much, if not more. But right, let's get to the practical stuff, because I know that's why you're here. When you notice things aren't working the way they should, the first thing you need to do is stay calm. I know that's easier said than done, but anxiety actually makes the whole situation worse. It creates this vicious cycle where worry leads to more difficulty, which leads to more worry. So take a deep breath, yeah? Your reaction in the moment can make all the difference. Now don't try to force it. That never works, trust me. Instead, take your time creating a relaxed atmosphere. If you can stay calm, you can create a comfortable environment for both you and your partner. And look, honesty is important here, but you can be honest in a light way. Something like, looks like we're having a bit of technical difficulty today, but let's enjoy ourselves anyway, eh? That kind of approach takes the pressure off and keeps things relaxed. Here's where it gets interesting, and this is the part that most videos won't tell you. There are loads of ways to maintain intimacy without traditional penetration. You can focus on exploring your partner's body with gentle touches, kisses, oral stimulation. The key is maintaining that connection and making it a positive experience for both of you. I'm not going to go into massive detail on techniques here because honestly, there's something way more important we need to talk about, and that's what's actually causing this and what you can do about it from a medical perspective, right? So let me put on my doctor hat properly here because this is crucial. If this is happening to you regularly, more than say 4 times a month, you need to understand that this could be your body trying to tell you something important. I've had patients who came in thinking it was just stress, and we discovered underlying diabetes, heart disease, or hormone imbalances. This isn't something to be embarrassed about. It's something to take seriously. Let me tell you about one of my patients. I'll call him John. John's 62, lives up in the Bay of Plenty, and he came to see me about 2 years ago, feeling pretty gutted. He said to me, "Doc, I reckon it's all over for me." But after running some tests, we found his testosterone was lower than a possum's belly, and he had early signs of cardiovascular issues. We got him sorted with some lifestyle changes and appropriate treatment, and within 3 months, he was back to his old self. He told me it was like getting his life back. So here's what I want you to do. If this is a recurring issue, you need to get checked out. Book an appointment with your GP and ask for these specific tests: a full blood count, fasting blood glucose to check for diabetes, a lipid profile for cholesterol, and absolutely a testosterone level. Low testosterone is incredibly common in blokes over 50, and it's one of the most treatable causes. Your doctor might also want to check your thyroid function and do a cardiovascular assessment, because honestly, erectile function is often an early warning sign of heart problems. Think of it like a canary in a coal mine. It's your body giving you a heads up that something needs attention. Now, let's talk about actual medical treatments, because there are really good options out there. You've probably heard of Viagra and Cialis, right? These medications work by increasing blood flow, and they're effective for about 70 to 80% of blokes. They're not magic pills. You still need to be in the right headspace and have stimulation, but they can make a real difference. The main difference between them is how long they last. Viagra works for about 4 to 5 hours, while Cialis can work for up to 36 hours, which some of my patients prefer because it feels more natural and spontaneous. But here's what a lot of blokes don't know. There are other options too. If you have low testosterone, hormone replacement therapy might be appropriate. I've had patients in their 60s and 70s who responded brilliantly to this. There are also injection therapies, vacuum devices, and in some cases, penile implants. I'm not saying everyone needs these, but it's good to know they exist. Another thing that can make a massive difference is looking at any medications you're currently taking. Some blood pressure medications, antidepressants, and even antihistamines can affect erectile function. Don't stop taking anything without talking to your doctor, but do have that conversation because often there are alternatives that don't have these side effects. Now, let's talk about what you can do right now, today, without even seeing a doctor yet. There are some lifestyle factors that have been proven to help. First up, exercise. And I don't mean you need to become some gym junkie, but regular cardiovascular exercise, even just 30 minutes of brisk walking 3 times a week, can significantly improve blood flow throughout your body, including where you need it most. I had a patient, 67 years old, who started swimming at the local pool 3 mornings a week. Within 2 months, he noticed a real improvement. Second, your diet. Cut back on the processed stuff, increase your fruits and vegetables, and especially foods rich in zinc like oysters. Yeah, I know that's a cliche, but it's actually true. Pumpkin seeds and lean meats. There's also good evidence for L-arginine, which you can find in supplements and foods like spinach, nuts, and seafood. Third, alcohol. Look, I love a good beer as much as the next Kiwi, but too much grog can really mess with your performance. Try keeping it to no more than 2 standard drinks a few times a week, not every night. Fourth, smoking. If you smoke, this is your sign to quit. Smoking damages blood vessels, and you need good blood flow for everything to work properly. There are heaps of support services available through the NZ Quit line, and I've seen so many blokes turn their health around when they finally kicked the habit. Now, here's something most doctors don't talk about enough. Kegel exercises for men. Yeah, I know, you probably think Kegels are just for women after having kids, but they're actually really effective for blokes too. These exercises strengthen your pelvic floor muscles, which play a huge role in erectile function. Here's how you do them. Next time you're having a wee, try to stop the flow midstream. Those muscles you're using, that's your pelvic floor. You want to contract those muscles, hold for 5 seconds, then relax. Do 3 sets of 10 every day. You can do them anywhere, watching the telly, driving, nobody knows you're doing them. Give it 8 weeks of consistent practice, and many of my patients report significant improvement. Let me tell you about another patient. I'll call him Dave. Dave's 58, and he was pretty skeptical when I suggested Kegels. He said, "Doc, that sounds like a load of rubbish." But he gave it a go anyway, because in his words, "What have I got to lose, eh?" 3 months later, he came back and said it was one of the best things he'd ever done. Combined with cutting back on his beer intake and taking a daily walk, he felt like he'd turned back the clock 10 years. Right, so let's talk about a practical roadmap here, because I know you guys like to have a plan. If you're dealing with this issue, here's what I recommend. Week 1 to 2. Keep a diary. I know it sounds a bit funny, but track when it happens, what circumstances were around it, how you were feeling, what you'd eaten or drunk. This information is gold for figuring out what's going on. Week 3 to 4. Make the lifestyle changes I mentioned. Start exercising regularly. Clean up your diet, cut back on the booze, and start those Kegel exercises. Also, make sure you're getting 7 to 8 hours of sleep a night. Sleep is absolutely crucial for testosterone production. Week 5 to 8. Assess how you're going. Are things improving? Sweet as, keep doing what you're doing. If things aren't improving, or if you noticed in your diary that this is happening more than 4 times a month, it's time to book that appointment with your GP. After 2 months, if lifestyle changes aren't enough, that's when you have the conversation with your doctor about medical interventions. Get those blood tests done. Discuss medication options. Consider whether you need to see a specialist. And look, I want to address something here because I know some of you are thinking it. There's this idea that once you hit 60 or 65 or 70, that's it. Everything's over in that department. That's absolute rubbish. I have patients in their 70s and 80s who have active, fulfilling, intimate lives. One of my patients is 83, and he's probably doing better than some 40-year-olds I know. It's not about your age, it's about your health and addressing any issues that come up. The thing is, our bodies change as we get older. That's just reality. But change doesn't mean the end. It means adaptation. And the good news is we have more tools and knowledge to help with that adaptation than ever before in history. You just need to be willing to take that first step and address it. Now, I do want to mention briefly those alternative approaches in the moment, because they have their place. If you're in a situation where things aren't working right then, oral stimulation and manual stimulation can absolutely be wonderful ways to maintain intimacy. Many women actually find these approaches more satisfying anyway. The key is to be attentive to your partner's responses, to communicate either verbally or through body language, and to stay present in the moment. But honestly, these should be part of a well-rounded intimate life anyway, not just fallback options. Here's the thing that a lot of blokes don't realise. Women often appreciate the creativity and attention that comes when you're exploring different forms of intimacy. I've had female patients tell me that when their partners started focusing on things other than just penetration, their intimate lives actually improved. So yeah, there's definitely value in broadening your repertoire, so to speak. One more important thing I need to mention: communication with your partner. Look, I know us Kiwi blokes aren't always the best at talking about feelings and all that, but this is one area where you really need to open up. If this is happening regularly, your partner deserves to know what's going on. Not in a heavy, dramatic way, just honest and straightforward. Hey, I've been noticing I'm having some difficulties lately, and I'm going to sort it out. Just wanted you to know it's not about you or how I feel about you. That kind of simple honesty can prevent a lot of misunderstandings and actually bring you closer together. I've seen relationships nearly fall apart because the bloke was too embarrassed to talk about it, and the partner started thinking they weren't attractive anymore, or that something was wrong with the relationship. Don't let that happen. A quick, honest conversation can prevent months of unnecessary worry. Right, so let me give you some practical next steps. First thing tomorrow morning, if this is something you're dealing with regularly, I want you to book an appointment with your GP. Tell the receptionist you need a longer appointment because you want to discuss some health concerns. Don't be vague. Don't be embarrassed. They've heard it all before. Trust me. Second, start a simple health diary today. Nothing fancy. Just note down your exercise, what you eat, how much you drink, how you sleep, and yes, how things are going in the bedroom. Do this for 2 weeks before your appointment. Third, commit to those lifestyle changes right now. You don't need to wait for a doctor's appointment to start exercising more, eating better, and doing those Kegel exercises. Start today. Fourth, have that conversation with your partner if you haven't already. It doesn't need to be a big sit-down talk, just an honest mention of what's going on and what you're doing about it. And look, I want to be clear about something. This video is not a substitute for proper medical advice. If you're experiencing this regularly, you need to see a healthcare professional. What I've shared with you today is based on 20 years of clinical experience and mountains of medical research. But every person is different and you need individualized care. But here's what I can promise you. This is fixable for the vast majority of blokes. Whether it's through lifestyle changes, medication, hormone therapy, or a combination of approaches, there are solutions. You don't have to just accept it and work around it. You can actually address the underlying issue and get back to feeling like yourself. I had a patient tell me once, "Doc, I thought I just had to live with it. I didn't know there was anything that could actually help. And that broke my heart because he'd been struggling for 3 years without seeking help. Don't be that guy. Don't suffer in silence. This is 2025. We have incredible medical tools available, and there's absolutely no shame in using them. So yeah, to wrap this up, remember that you're more than any one aspect of your physical function. Your worth as a man and as a partner isn't determined by your erectile function. But also remember that if this is an issue, there are real, practical, medical solutions available. You don't have to just accept it or find workarounds. You can actually fix it in most cases. Make that appointment, make those lifestyle changes, and don't give up. I've seen too many blokes get their confidence and their quality of life back to believe anything else. You deserve that too, mate. Alright, if you found this helpful, make sure you subscribe to the channel and hit that notification bell. I put out videos specifically for you guys regularly, covering all sorts of health topics that matter as we get older. And hey, share this video with your mates if you reckon they might benefit from it. Sometimes we all need that little push to take care of ourselves. Yeah? Drop a comment below if you have questions. I try to respond to as many as I can. And if you want me to do a follow-up video about any specific aspect of this, like detailed information about testosterone therapy or those medical tests I mentioned, let me know. Take care of yourselves out there, and remember, it's never too late to take charge of your health. Cheers.